Do you know the difference between a strain and a sprain? It's easy to get these two confused, but understanding the distinction is crucial, especially if you're involved in sports or physical activities. A strain is often referred to as a pulled muscle. It occurs when the fibers within a muscle or tendon stretch too far or tear. This can happen during a sudden twist, a forceful jump, or when lifting something heavy. Symptoms of a strain might include swelling, pain, limited movement, and muscle spasms. A sprain, on the other hand, deals with the ligaments, the tough bands of fibrous tissue that connect our bones at the joints. Sprains occur when these ligaments stretch beyond their limits or tear. This can happen when you roll, twist, or turn your ankle in an awkward manner. Symptoms of a sprain can include pain, swelling, bruising, and a limited ability to move the affected joint. When it comes to treatment, strains and sprains share some similarities. Rest, ice, compression, and elevation, commonly known as the Rice method, can be beneficial for both. Over-the-counter pain relievers can also help manage discomfort. However, it's important to remember that serious strains and sprains may require medical attention. A severe strain could need physical therapy or even surgery to mend a torn muscle or tendon. Similarly, a serious sprain might require a brace or surgery to repair a torn ligament. So, to summarize the key differences, a strain involves a muscle or tendon, usually resulting from overstretching or tearing, and is often associated with activities like lifting or jumping. A sprain involves a ligament and often results from a twisting motion like turning your ankle. Both can cause pain and swelling, but the location and nature of the injury can help distinguish between the two. Remember, understanding these differences is not just about knowing medical jargon. It's about knowing your body, recognizing when something is wrong, and taking appropriate action. So next time you experience an injury, you'll be able to determine whether it's a strain or a sprain, and know how to take the first steps towards recovery.